Good morning. I tend to get real excited when I talk with my hands and move around, so I'm going to try and stay in one place. I don't know how that will work out. My name is Jini Puma, and I joined the Rocky Mountain Prevention Research Center about 5.5 years ago, and then just really recently joined the faculty for community and behavioral health. And prior to working with the RMPRC, I worked at the University of Denver doing early childhood development research. And when I joined the RMPRC, I was very excited to learn about the great work that Aline Belansky and Julie Marshall were doing in obesity prevention. But they were doing work primarily with elementary and middle schools at the time. And coming from my background, I always said in meetings, I constantly said, why don't we start earlier? And finally, I was fortunate enough to receive a grant from the Colorado Health Foundation to do just that. So that's what I'm going to talk to you about today. It's called A Culture of Wellness in Preschools. Let's see if I can get that. Just to give you a little bit of background why I feel it's important to focus on preschools, we know that, as you've already heard several times today, about the obesity crisis, it is no different with preschool children. The prevalence of obesity for U.S. preschoolers has doubled in recent decades. In 2009, 2010, it was about 12% for the U.S., and in Colorado, it's somewhere between 10 and 11%. So we're a little bit under that, but we know that it affects low-income and children, ethnic minority children, disproportionately. There was a study that was actually just released a few weeks ago, about 3 weeks ago. I don't know, 10 people sent it to me in the same day that showed actually the good news is that it looks like for many states obesity the prevalence of obesity for preschool children is actually declining. However, in 3 states it is increasing over the past few years, and Colorado happens to be one of those states. The others are Tennessee and Pennsylvania. I feel it's important to focus our obesity prevention efforts in early childhood for 2 reasons. The first is that this is a time when children develop their basic motor skills, which we know is linked to later physical activity. And it's also a time when children develop their food and nutrition-related attitudes, preferences, and behaviors. We know that kiddos who are obese as preschoolers tend to be obese as adolescents and adults, and they tend to develop many of the chronic conditions that we all are familiar with. I feel preschools have the potential to make valuable contributions to the prevention of obesity. A recent Robert Wood Johnson Foundation study estimated that about 50% of 4- and 5-year-olds are based in center-based care. So it's an opportunity to really reach a large percent of our preschool children by working and partnering with early child care centers. So just a little bit about our formative work. We developed a partnership with Denver's Great Kids Head Start, which is through the city and county of Denver. And then this project is very collaborative. We have a number of other partners that are listed down there at the bottom. Just to give you a little bit of the understanding of the complexity of Denver's Great Kids Head Start. Basically, federal Head Start funds flow into the city and county of Denver, and Denver's Great Kids Head Start is housed there. Then there's 6 delegate agencies that are underneath the Denver's Great Kids Head Start. It's Catholic Charities, Clayton, Denver Public Schools, Mile High Montessori, Volunteers of America, and Family Star. And then underneath those delegate agencies, there's individual Head Start sites. So this structure has been a bit challenging. I'm looking at Gloria Richardson here. Here is my partner. It's been a bit challenging to navigate when we were planning this intervention and to actually implement it. But we have managed to do so. So when we were planning this, we conducted 11 meetings with management level staff in order to get their buy-in for the project. We also conducted focus groups with all of the teachers and staff at 23 of the 25 sites. And we really wanted to understand what current wellness initiatives were going on, what barriers and challenges they thought we might encounter in what we were proposing to do, what programs and activities they actually wanted, what level of ownership they wanted to take in the project, because it was very community engaged, and then really to clarify what our intervention plan would be. We also conducted focus groups with parents, and we convened a project steering committee which was comprised of Head Start representatives as well as the leads with all of our local partners. And there's our project team and our steering committee. We also considered the socio-ecological model when we were planning this. So we focused, you'll see here when I describe the intervention, we focused not only on the children, but also on their parents and on the preschool environment and policies. There's our one-pager, and again you see sort of the three circles, the child, home, and preschool. And we felt it was incredibly important to include parents and teachers in the intervention because the children are so young. Oftentimes those are the adults that make so many of the decisions related to physical activity and healthy eating in their lives. We really worked with our steering committee to develop what I call the backbone to the Culture of Wellness in Preschools project, and that was key messages that really stayed on target. So we had 5 focus areas for our key messages. The first is feeding relationships with adults and the children and helping children be good eaters, family meals and eating at home, physical activity and screen time, beverages, both limiting sugar-sweetened beverages and increasing low-fat milk consumption, and then fruit and vegetable consumption. So all the various components stay on target with these messages so that parents and staff are getting these messages repeatedly and in different ways. But we really tried to make this very concise and tight. Oops. All right, so for the children, we have 2 programs, the Integrated Nutrition Education Program for preschools. So INEP is based out of here. They are a nutrition education program focused on helping children in kindergarten through 5th grade, but we worked with them and with preschool teachers to develop it to be appropriate for preschool. There are about 12 to 15 classroom lessons. It's a very interactive program so that children get hands-on experience in making healthy foods. There's a book, a developmentally appropriate book that goes with each lesson, and then food is delivered to every classroom so that the children can make a healthy snack. And we know that kids that are involved in making a snack are much more likely to actually eat the snack. We also have I Am Moving, I Am Learning, which is more of a professional development program. Each classroom received physical activity equipment, so things like pool noodles and hula hoops and balls that could be used on the playground. And then the teachers were trained in I Am Moving, I Am Learning, and our trainer provided technical assistance in the classroom, in each of the classrooms with the teachers. And it's really helping teachers to be intentional about getting children to be physically active throughout the day. For our staff, we have a workplace wellness program. It's a very individualized program, so it kind of looks different at each of the sites based on the staff needs. But the 4 goal areas are health education, so we've disseminated a lot of flyers and newsletters. There are posters at each of the sites with health information. Physical activity, there's most of the sites have started walking clubs, but we've also linked staff members to local Denver Parks and Rec facilities, and they're using those facilities for free. healthy eating. So we have, there's lunch clubs at the sites where, like for example, on Tuesdays, it's Toss It Tuesday. So everyone brings a salad, something that could be used in a salad, and the staff get together in the staff lounge and put together their salads and eat together. And then through the adapted intervention mapping strategic planning process, which Sheena mentioned, Elaine has been working on, we have made site environment and policy changes focused on health eating and physical activity. All the staff are able to take Cooking Matters courses, so we've partnered with Cooking Matters. It's a 6-session cooking course that teaches adults how to cook and eat healthy on a budget. So it's very sort of culturally appropriate with the group that we're working with. For the parents, they can also take advantage of the Cooking Matters courses. Last program year, we offered 17 courses, and for the most part, they were filled to capacity. We also have community health workers, or promotores de salud, that we have recruited from the Head Start sites. We've trained them in motivational interviewing, and they meet with parents to deliver the child's individualized heart print. What the heart print is, we've worked with the Head Start nurses to get height and weight data for the kiddos, and then we plot their BMI on the BMI curves. And through a parent interview process, we ask parents about the child's lifestyle at home related to eating and physical activity. And there are 10 questions related to obesity risk. And you can see, I know it's really tiny, but on the heart print, wherever the hearts are, those are areas where the child is not meeting recommended practice, and the parents can consider making changes at home. And so this is given to the parents. The health promoter talks first about all the great things that the parent is doing with the child to promote healthy lifestyles, and then areas for improvement. So that's that. Let's see, I'm getting the time signal. So, and then the last piece that I want to just highlight is we've worked with health promotion committees at each of the delegate agencies. There's members from each of the sites that comprise these committees, as well as directors or people that have decision-making capacity. And they go through this strategic planning process called adapted intervention mapping. It's an 8-meeting process where they do a needs assessment, they look at evidence-based environment and policy changes that they can make, and then they actually decide on which changes they want to make. And Charlotte Farewell, who's sitting over here, is our fearless leader, and she's done remarkable work with our health promotion committees. So this is an evaluation. We've done a program evaluation of this. Unfortunately, we don't have a comparison group, but I hope future funding will help with that. We did do a mixed methods evaluation and looked at pre-post data. We collected staff surveys, parent surveys, SoPlay, which is a time series observational tool, that we used on the playgrounds to assess children's moderate to vigorous physical activity. Classroom food tasting observations, where we looked at children's willingness to try fresh fruits and vegetables and liking of fresh fruits and vegetables. And then we had a center environment and policy survey that was completed by the director of every site to understand what environment and policies were in place at the site that promote physical activity and healthy eating. We also collected focus group data. So we conducted focus groups with staff, parents, and with the members who participated in the health promotion committees. And we're very much in the mix right now of analyzing the data, but we do have some sort of preliminary results to share. Overall, the results were very encouraging. When we asked staff about their perception of child outcome related to the INEP program, the majority of staff indicated that they felt children were more knowledgeable about nutrition. They were more willing to try new foods because of the INEP program. program. They were more willing to select fruits and vegetables at snack and mealtime, and they were more confident in preparing food with the help from adult. And then a lower percentage, I'm not sure on mine, so a lower percentage, but still 42% felt that this carried over into the home. And this program, the recipes that the children make in the classroom do go home so that parents can make them at home. And from the focus groups, we heard that parents were actually making those with the children. And then there's newsletters that go home with the parents as well. So it does appear that it's spilling over into the home, some of the effects. When we observed the children, doing food tasting, what we called food tasting parties, we did see that there was a slightly larger percentage of children at post that tried the fruits and vegetables that we presented to them and liked them. And on the sort of flip side, a slightly lower percent that refused to try the fruits and vegetables. For I Am Moving, I Am Learning, when we asked staff about the perceived impacts on children, 91% of the staff felt that children were more active at school because of I Am Moving, I Am Learning. And then when we actually observed the children on the playground, we did 3 observations at pre and 3 at post. We did see about a 7% increase in children that were engaged in moderate to vigorous physical activity. And we also saw that more portable play equipment was located on the playgrounds, which is a best practice and which is linked to increasing physical activity for children. And then lastly, for the environment and policy changes, through the AIM process, there were a total of 68 changes that were selected across all the sites. 35 were child-focused and 33 were staff or parent-focused. 53 were evidence-based or promising strategies. Some of those that weren't, the Head Start teachers were real excited to implement something that was related to physical activity and healthy eating, but wasn't necessarily a best practice. But we encouraged that creativity and helped support the changes that they wanted to make. And on average, sites made about 4 changes, which is great. In our grant application, we proposed to have them make just 1, so they far exceeded that. And then I'll just end with one of the really exciting parts of this project, I think, is that right now we're working with Denver's Great Kids Head Start on this sustainability plan. So they're creating what they're calling the Healthy Weight Initiative. And the bottom tier will be aspects of the culture of wellness in preschools that will carry on beyond the term of our grant. So they now are allocating funds to support INEP, I Am Moving, I Am Learning, the education campaign, and the AIM process. So that will reside within their agency. They're designating people who will be responsible for that and funds to continue that work as a prevention to prevent obesity. Everyone will receive these interventions. Then tier 2, they're looking at doing more intensive interventions with children who are diagnosed or who are classified as overweight, and then even more intensive intervention for those kiddos that are obese. But the sort of groundwork for their Healthy Weight Initiative will be everything that we started with the Culture of Wellness in Preschools project. And I think, this was her slide that I popped in there. So, and I think that's all. Are there? Yeah. Mm-hmm.
Similar steps over there, your goal is to use the evidence, not build evidence. And so I just wonder if it would make a good thought lesson, like bringing health matters, and maybe the American Journal of Public Health or something to line this up. For those of us who are applied, when we might use one tool versus when we might use the other tool or approach. And are there similarities that are worth highlighting?
Yeah. All right. Well, thank you very much. I would actually say that the AIM process is using evidence-based. So we're not really building evidence. It is using existing evidence, and we have a menu of best practices related to healthy eating and physical activity, site and environment and policies. And so they look at that menu of evidence-based environment and policy changes and then decide what would work best for them. But in a few cases, just as you mentioned, sites had ideas of, it's really sort of working the other way, practice-based evidence. So they had this idea that this would really work with our kiddos. So let's try and incorporate this. And so it's not necessarily evidence-based, but we supported that. And so we are looking to collect data about those changes and whether or not they're working. But for the most part, the aim is more working like the Bronson approach, where it is implementing evidence-based practice. But I appreciate that comment, something to think about.